In this video, we're going to discuss how to properly don personal protective equipment. First, assess the need for PPE. Collecting your supplies, including gloves, a gown, a face mask, a face shield or eye goggles, an N95 respirator when indicated, a hair cover, and shoe covers. Once you've gathered your PPE, don your isolation gown first. Picking your isolation gown up by the shoulders, allowing it to fall open without touching any contaminated surfaces. Slip your arms into the sleeves and fasten the tie at the neck and then around the waist. If the gown does not completely cover your clothing, wear two gowns. Start by putting the first gown on with the opening in the front and the second gown with the opening in the back. Next, you will don your N95 respirator when indicated. When placing your N95 on, ensure that the metal strip is at the top bridge of your nose and tightly secured. If an N95 is not required, don your face mask. Again, ensuring that the metal strip is over the bridge of the nose and the top ties behind your head. Place the lower edge of the mask below the chin and then tie the lower ties. Next, we'll don our face mask, ensuring that it covers our eyes. Remember that each face mask will be applied differently. Just ensure that your eyes are covered and you're using it properly. If you are using safety glasses or goggles, don them now, ensuring that you are setting them over the top edge of the face mask. Next, we'll don our hair cover. And then we will don our shoe covers. Finally, we will don our gloves, ensuring that we've selected the appropriate size. If we're wearing a gown, make sure the glove cuff extends over the cuff of the gown. If there is not complete coverage, tape the glove cuff to the gown. When applying any PPE, removing your personal protective equipment in the following order, ensuring that you are considering the front of the gown, the outside of the sleeves, the mask and the gloves, as well as head and shoe covers if wearing them, contaminated. You will consider the inside of the gown, the inside of the gloves, and the ties on the mask, and the ties at the back of the gown and the inside of the head and shoe covers as clean. First, remove your gloves. Remove the first glove by grasping at the cuff of the glove and pulling downward so the glove turns inside out. Hold the removed glove in the remaining gloved hand. Slip the fingers of the ungloved hand under the inside of the cuff of the second glove and pull the glove off inside out, turning it over to enclose the first glove, ensuring that you're not touching any of the contaminated surfaces with your bare hands. Hold the contaminated gloves away from you and dispose of them in the appropriate container. Next, we're going to remove our gown. We're going to first release the neck and waist ties of the gown. allowing the gown to fall forward. You're going to slip your hands inside the gown neck and peel down off the arms so that the inside of the gown faces outward. Reach inside to pull off the cuff and remove the arms from the sleeve one at a time. Do not touch the front of the gown. Hold the gown away from your body, fold it inside out, and discard, ensuring you don't touch any of your clothing with the dirty gown. Next, we're going to remove our face shield and our hair cover in any order. So we're going to go ahead and remove our hair cover first, placing our fingers on the inside and pulling it off. Next, we'll remove our face shield or goggles by releasing or pulling the strap from the back of our head. Do not touch the front of the shield. Next, we're going to remove our mask by untying the lower ties first, and then the upper ties. Being sure not to touch the front of the mask. If you are using a respirator, do not remove the mask in the patient's room. Wait until after leaving the room and the door closed. Dispose of it properly. Next, we're going to remove our shoe covers. Again, ensuring that you're touching the inside and not the contaminated surfaces. Once they're removed, you should perform hand hygiene and ensure that the door to the patient room is closed. Again, ensuring that you're following hospital protocol when removing PPE.